Hey, Mark Green here from diabetesdietguide.com, bringing you free blogs about diabetes online and online courses to help maximize and optimize your blood glucose control. So if you haven't checked out the blog, make sure you head over to diabetesdietguide.com and hopefully we have the answers to your questions. Now today we are looking at a question that comes up an awful lot for me in clinic and just generally online, which is what is a normal blood glucose or blood sugar level? So I wanted to do an initial overview video looking at this subject, but as you'll see as we go along, there's lots of individual factors to look at. So what we probably do is offshoots of these individual constituents to look at each variable in a bit more detail. Now, one of my bugbears in clinic is when a patient comes in and they have seen another healthcare professional, perhaps someone that doesn't specialize in diabetes, and they will say that your blood glucose levels need to be between 4 and 7. And that is a blanket application. So they will say that to every diabetes patient. Now, if only it was that simple. Now, keep in mind that the whole point in diabetes is that your body is struggling to control its blood glucose levels. So for someone to keep their blood glucose levels between 4 and 7 is really, really hard, because essentially you're swimming against the tide because your body doesn't want to have glucose levels between 4 and 7. It's even hard to do that without diabetes, which I'll go on to show you in a minute. So if it's hard to do it without diabetes, how can someone with diabetes, that by definition has problem controlling their blood glucose levels, achieve the same control? And also in certain situations it can be risky. So we're going to look at what is a normal blood glucose level, the different types of diabetes and how to apply normal blood glucose levels to those, how that relates to your average glucose control, and then maybe look at a little bit about the differences in terms of what happens when you eat a meal between someone without having diabetes and someone with diabetes. So anyway, that's the intro. So you could return to the trusted board that I bring to most of my videos and get into it. Now, we have a few different variables here. We have a low blood sugar level, normal blood sugar level, and high blood sugar level, also called glucose, by the way. And we have your finger prick test, and we also have your 3-month average, which is called a HbA1c test. If you're not familiar with the HbA1c, check out the blog, loads of information about it. Now we'll ignore this graph for the minute, we'll come to that in a minute. So in a simplistic way of looking at it, a low blood sugar level is considered anything below 4. So 4 is the floor, is a saying we have in diabetes. However, if you don't have diabetes, or you're not taking any medications that push your blood glucose levels low, like insulin and sulfonylureas, such as gliclazide, then you probably have a bit more margin with this, because your body will kick in and bring you back. So let me give you an example. I have worn a continuous glucose monitor. Well, actually it was a flash glucose monitor. It's slightly different, Freestyle Libre. So it tracked my glucose levels 24 hours a day, 7 days a week for 2 weeks. And what you find is when people without diabetes wear these devices, or if you just did finger prick tests throughout the day, actually most people drop below 4 quite a lot. So you'll get readings like 3.8, 3.6. Generally it will be somewhere between 3.5 and 3.8. So actually a clinical hypo isn't technically until your blood glucose levels drops below 3.5, and some physicians or clinicians will even say until it drops below 3. So that's quite a significant drop. So why do we say 4 is the floor? The reason we say that is because when we're talking about hypos, as they're called, low blood sugars, with patients, it's because we're giving them medications that can push their glucose levels too low. So if you tell someone that a low blood sugar is actually below 3.5 or even 3, they're already in the low blood sugar clinically, and therefore they might not be equipped, because again, it affects your cognition and actually your ability to treat yourself to get out of the low blood sugar. So what we want to do is build in some margin to allow them to react before the problem actually becomes serious, so they can take some preventative action to stop it happening. So 4 is the floor, generally speaking, but actually if you did track everyone's glucose levels, it would drop below 4 on a day-to-day basis. Then moving on to a normal glucose level. So again, interestingly, when I and my colleagues, or my colleagues and I, have worn these continuous glucose monitors without diabetes, or we've just done random tests, you'll find you'll get quite a range in your glucose levels depending on what you've done, whether that's just eaten, or you've been exercising, or you've gone a long period without eating. So we already know that 4 is a normal glucose level, but take it with a bit of a pinch of salt, assuming you're not taking anything to push your glucose levels too low. But the other end of the spectrum, when you think about it, type 2 diabetes on a random finger prick sample isn't diagnosed until your glucose levels are above 11. So by definition, if diabetes is diagnosed with a random finger prick sample above 11, then anything below 11 is technically a normal glucose level. Now, don't get me wrong, if you came to me in clinic and you had a glucose levels of 10.5, you know, it's not too bad, but it's getting there. It's pushing it towards that diabetes range. When I wore the glucose sensor, I found that my glucose levels went as high as 9.3, I think it was. It was definitely over 9, it was definitely below 10. But the difference is how quickly your glucose levels come back to normal. More about that in a minute. So actually, someone without diabetes, if they tested their glucose levels at the right time, can have a range between below 4 and as high as 9, maybe even above 10. So then when you have someone to tell you that your glucose levels need to be between 4 and 7, you can already see that we're creating a false economy. Now often what they'll be referring to is before the meal. So you're giving your glucose levels a chance to get back to normal. So breakfast, lunch, dinner, evening. So those time points in the day where your glucose levels should have recovered from eating. But still, it's a very tight margin. And we particularly wouldn't suggest that for someone that is taking insulins or other medications like sulfonylureas to push your glucose levels down, because the tighter you run your glucose levels, the more chance you have of having these low glucose events. So hypos, which can be dangerous and aren't without their long-term complications, because each hypo is like a little kick to the brain, and kicks to the brain don't end up well long-term in terms of things like dementia risk, Alzheimer's risk, etc. So we're very keen to avoid them, okay? But if you're not taking those medications, then yeah, you do have some margin. So ideally, that's where we want to be living. Somewhere between 4 and 10 is a pretty good range. If you're taking those medications that push your glucose levels too low, my general recommendation is running between 5 and 10. That's a good target level, and you're not going to be at any increased risk of problems because you're aiming a little bit higher than someone that's aiming between 4 and 7, or someone without diabetes whose glucose levels are between 4 and 9. There's just not much difference there in terms of the long-term risk. So then anything considered high. So this is something that is over 11. Okay, so your glucose levels will be regularly going above 11. That's indicative of type 2 diabetes, or any diabetes for that matter. So we're keen to not see that happening too often. Now, obviously, the further away you get from 11, the more severe it becomes. So if you're someone that's going to 11.1, you know, it's high, but it's not too high. So actually your overall glucose control is probably going to be okay if that's the highest you're going. Whereas if someone's regularly recording glucose levels of 25, then obviously you've got a bigger gap between normal and abnormal, and therefore your glucose control isn't going to be as good, and that's when the long-term risks for complications and things start to increase as well. So that's the finger prick. So let's look at the HbA1c. So as I said, the HbA1c is your 3-month average. So we can look back and see how much glucose is sticking to your red blood cells, and your red blood cells last 3 months in your body. So we can take a sample and see how much glucose is stuck on there and reverse engineer it and see how your glucose control has been. So there's a couple of variables that may affect that, like if you're anemic, or if you have a low HbA1c, particularly if your HbA1c is particularly low, like under 20, which may indicate some form of hemoglobinopathy, like sickle cell disease. So we shouldn't see really low levels of this. Then a normal HbA1c is probably anywhere, like when we see people in clinic, it will be somewhere between mid to high 20s usually, all the way up to 42, well 41 technically. 42 is when you're in the pre-diabetes range, okay? Don't know why I do this, it's a fact, the pre-diabetes range. Now obviously if you have a HbA1c of 41, technically you're not in the pre-diabetes range, but you're nearly there. So that might mean that you might want to think about taking some action if you're a bit overweight, not neglecting your physical activity, or you know your diet's not great. You're not there yet, but you will be. Whereas someone that has a HbA1c of 31, you're miles away. So you're all good in that respect. Some people will report this in percentages. So anything below 6.5, essentially, 6.5% would be considered non-diabetes. I must admit off the top of my head, I'm not sure what that would translate to for pre-diabetes. It's probably something like 6.2%, something around there. So basically each percentage rise, so 7.5, would be an 11 millimole rise in the UK or European measurement of millimoles per mole. So the next level up to 7.5 would actually be 59 millimoles per mole, if that makes sense. So you just go up in 11s in this number, and this will go up in 1%. So to put that back to 37, then that would be 5.5%. So that kind of gives you an idea. So yeah, probably about 5.8, 5.9% would be around the pre-diabetes range. Anyway, I'm dwelling on this point too long, let's move on. So then a high HbA1c is anything over 48 millimoles per mole, which is 6.5%. And again, it's the same issue with the finger prick. The further away you get from this number, the higher it goes, the worse your glucose control will be. So again, we're trying to optimize people as closely as possible to 48. The gold standard is between 48 and 53 on the HbA1c test with diabetes. Ideally, you won't have diabetes and it will be lower than that. Now, obviously, if you have type 1 diabetes, it's very hard to get that below 48 without frequently having low blood glucose levels. So you might find that you meet a bit of resistance in clinic with regards to how low your healthcare professional wants you to drive this. You might be thinking, well, I want normal glucose levels like if I didn't have diabetes. The problem is, it's near on impossible to do that without having low blood glucose levels where you're becoming symptomatic and giving those little kicks to the brain, whereas someone without diabetes doesn't have that extra consideration. And the other important point to think about is actually having a HbA1c of say 42 with type 1 diabetes, or even in the 30s, gives you no real additional benefit in terms of your long-term health risks than having a HbA1c of 48. In fact, if anything, it's counterproductive because I can almost guarantee you will be hypoing whether you're aware of it or not. So that's the ranges, okay? So lots of different variables there. And like I say, we'll probably look at the individual constituents in separate videos later. So let's move on to the next bit. So actually another big difference about diabetes patients and people who don't have diabetes is the speed at which your glucose levels will come back. So let's say someone without diabetes, their glucose levels in the green here rises to 9, just like I did when I wore the flash glucose monitor. But what I found is I would be back in target, I'd be back to normal almost, or my rest fasting glucose level within about 30 minutes. So it'd be ticking along between 4, 5, 6 quite happily. Whereas when I look at people with diabetes, what happens is the glucose level might go to the same level, so it might only go to 9 or 10, but it will stay there for a lot longer before it drops back. So you'll see that people who are diet controlled with type 2 diabetes or taking quite modest therapy, like maybe just one tablet or one type of medication, a couple of types of medications. But we do see this pattern with people who are taking multiple therapies, but the point is they may stay elevated for longer. And then you also have the people who have a much higher glucose response. So they'll eat the meal, it will shoot right up, above diabetes ranges, I suppose. And then it will do one of two things. It'll either come back to where they started. So that's quite common with people that use insulin. So it will come back to where they had their normal glucose levels to where they started, which shows us actually the insulin dose is correct. But instead, actually what's happening is they've probably eaten something that's too fast releasing, or their timing of their injection for insulin isn't well timed with the food. So they could also move their insulin injection a bit earlier to offset this rise. Or you find what happens is it goes up and then it doesn't come back to where it was initially. So it's running a bit higher. So the next meal they have will kick it even higher. So they start to stack their glucose levels as the day goes on. So that's how people end up with high glucose levels. So a few different variables that affect how your glucose response will happen and what is considered high. Now, it can be very difficult, as I said at the beginning, to try and mimic this with someone with diabetes, trying to get normal glucose levels with diabetes. And like I said, the reason is that your glucose levels don't want to behave like that. So if you're talking about type 2 diabetes, we can do two things. We can treat the disease itself with medications to try and get as close to this as possible, but in reality, you're probably getting more like this blue line. You can try and control it with diet, or you can try and treat the underlying cause of the disease with diet and lifestyle interventions to try and treat the reason this is happening in the first place, which is typically too much fat around the liver, around the pancreas, and in the cells of the body. So as you start to break down that fat, usually by losing weight and getting fitter, what you'll find is your body will start being able to tolerate that sugar and glucose in the body a bit better, and so you'll start to turn back the clock and actually start to get to a point where you resemble more this pattern than this pattern. It might not get exactly there, but it will improve. Like I say, with someone with type 1 diabetes, you're never going to get that sort of response, just because the insulins take quite a while to kick in before they start working. And so what we're trying to do is actually just do the best that we can. Now, obviously with these parts here, and with the blue as well, the other thing we need to think about is how does that actually translate into the average control? Because obviously, if you're going high, it's not ideal, but if ultimately it still means that your HbA1c is in normal levels, it's neither here nor there. So actually what we're looking at is the average control regardless of these spikes. Now, if you are finding, let's say you tested your glucose levels here and you tested your glucose levels here, both of which are in normal ranges, or very normal ranges, sort of hovering around 4, but then your HbA1c comes back and it's actually much higher than you expected, what that shows you is, in between the meals, you're probably getting big spikes. So your average control, because that spike is feeding into the average, is much higher than you expected, and therefore you might want to do a 2-hour post-meal test to see what's happening. So yeah, so I think that's probably all we want to talk about today, guys, just so the video doesn't go on too long. Now remember, we'll go into the individual variables by themselves in separate videos, so keep an eye out for them. If you want to know when we post, make sure you hit the subscribe button and turn on notifications, and then you'll see when these videos come up. If you want more information about diabetes, glucose control and healthy living, check out the blog, diabetesdietguide.com. Plenty of free information there for you. And we also offer online courses for people that just need a bit more of a helping hand and a step-by-step approach. So we offer that as well. So we'll leave it there. Thanks for watching. I hope you enjoyed the video, and we will see you at the next video.